In the realm of infectious diseases, new viruses emerge periodically, posing threats to global health. Two such viruses that have garnered significant attention in recent years are Human Metapneumovirus, or HMPV, and COVID-19. While both viruses are respiratory viruses and share some similarities, they also exhibit distinct characteristics that influence their impact on human health. HMPV, first identified in 2001, is a common respiratory virus that primarily affects young children, older adults, and individuals with weakened immune systems. COVID-19, on the other hand, emerged in late 2019 and rapidly spread across the globe, causing a pandemic with unprecedented consequences. Understanding the nuances of each virus is crucial for effective prevention, diagnosis, and treatment strategies. This essay aims to provide a comprehensive comparison of HMPV and COVID-19, exploring their origins, transmission, symptoms, severity, and potential complications. By examining the key differences and similarities between these two viruses, we can gain valuable insights into their respective threats to human health. Ultimately, this knowledge will empower individuals and communities to make informed decisions about protecting themselves and others from these respiratory pathogens. HMPV, a member of the paramyxovirus family, is thought to have originated in birds before jumping to humans. It spreads through respiratory droplets released when an infected person coughs or sneezes. These droplets can infect others if they land in their nose or mouth, or if they touch surfaces contaminated with the virus and then touch their face. COVID-19, caused by the SARS-CoV-2 virus, is a beta coronavirus believed to have originated in bats. Like HMPV, it primarily spreads through respiratory droplets. However, COVID-19 has shown a higher transmission rate, meaning it spreads more easily from person to person. This is partly due to its ability to remain airborne for longer periods and its potential for asymptomatic transmission, where infected individuals without symptoms can still spread the virus. Understanding the origins and transmission routes of these viruses is essential for implementing effective public health measures. For instance, knowing that both viruses spread through respiratory droplets highlights the importance of practices such as covering coughs and sneezes, frequent hand washing, and maintaining physical distance from others, especially those who are unwell. Both HMPV and COVID-19 cause similar respiratory symptoms, making it difficult to differentiate between them based on symptoms alone. Common symptoms shared by both viruses include cough, runny nose, sore throat, fever, and shortness of breath. However, some subtle differences in symptoms can provide clues about the causative virus. For instance, HMPV infections are more likely to cause wheezing, especially in young children. COVID-19, on the other hand, is associated with a loss of taste or smell, a symptom less common with HMPV. It's important to note that these are just general observations, and individual experiences can vary greatly. Moreover, many other respiratory viruses can cause similar symptoms, further complicating diagnosis based solely on clinical presentation. Therefore, laboratory testing is crucial for accurate diagnosis and to guide appropriate treatment decisions. While both HMPV and COVID-19 can cause respiratory illness, the severity of disease can vary significantly. HMPV typically causes mild, cold-like symptoms in most individuals, particularly healthy adults and older children. However, it can lead to more severe complications in vulnerable populations, such as infants, older adults, and those with weakened immune systems. In these individuals, HMPV can cause bronchiolitis, pneumonia, and respiratory failure, requiring hospitalization. COVID-19, on the other hand, has a wider range of severity, from mild, asymptomatic infections to severe illness and death. While a significant proportion of COVID-19 cases are mild, the virus can cause severe pneumonia, acute respiratory distress syndrome or ARDS, multi-organ failure and death, particularly in older adults and those with underlying health conditions. Furthermore, COVID-19 has been linked to a broader range of long-term complications, collectively referred to as long COVID. These complications can affect various organ systems and include fatigue, brain fog, shortness of breath, heart problems, and mental health issues. While long-term effects of HMPV are less well documented, they are generally considered to be less common and less severe than those associated with COVID-19.